Good morning, everyone. Today, we are going to simplify an important and often confusing topic, which is neuropathies. Now, before we go further, let me ask you something. What do we actually mean by neuropathy? Neuropathy simply means damage to peripheral nerves, leading to problems with sensation, movement, or autonomic function. Think of it as a roadmap of nerve damage, starting from the brain and spreading outwards. Now, let me ask you, how do we classify neuropathies clinically? The most important way is by recognizing patterns. Because in medicine, pattern recognition is everything. How does the distribution of nerve involvement help us? If only one nerve is affected, we call it mononeuropathy, just like carpal tunnel syndrome. If multiple nerves are affected asymmetrically, this is mononeuritis multiplex, and this should make you think vasculitis. Now, here's the most important one. What is the most common pattern? It is polyneuropathy, which is symmetrical distal, the classic stocking glove distribution. And whenever you see this, think diabetes. What happens when different nerve fibers are affected? Motor involvement leads to weakness, wasting, reduced reflexes. Sensory involvement causes tingling, burning pain, and numbness. And autonomic involvement affects blood pressure, gut, and bladder. But remember, most neuropathies are actually mixed. How do we differentiate axonal from demyelinating neuropathies? In axonal neuropathy, the nerve fiber itself is damaged, so the signal becomes weaker. It gives reduced amplitude on nerve conduction studies. In demyelinating neuropathy, the insulation is damaged, so the signal becomes slower, which gives reduced conduction velocity. So remember this forever. Axon is equal to strength and myelin is equal to speed. Why is the time course important? If it develops rapidly over days, think Guillain-Barré syndrome. If it is subacute, think toxins or nutritional causes. And if it is chronic, think diabetes or hereditary neuropathy. Now let me ask you, what are the causes of neuropathy? The most common cause worldwide is diabetes mellitus. Toxic causes include alcohol, chemotherapy, and heavy metals. What about nutritional causes? Vitamin B12 deficiency is very important, especially because it causes sensory ataxia, which infection can cause neuropathy, HIV, leprosy, and others. What about immune causes? Guillain-Barré syndrome and CIDP. Are there any genetic causes? The answer is yes, Charcot-Marie-Tooth disease. And sometimes we don't find a cause, these are idiopathic. Now, what is actually happening inside the nerve? In axonal degeneration, there is a dying back process, which is why symptoms start from the feet first. In demyelination, the signal slows down or gets blocked. Now let's think clinically. What symptoms do patients with neuropathy presents with? Sensory symptoms can be burning pain, tingling, or numbness. Motor symptoms include weakness, foot drop, wasting, and reduced reflexes. Autonomic symptoms include postural hypotension, gut dysfunction, and bladder issues. How do we use patterns to diagnose the cause? Stocking and glove pattern, diabetes, asymmetric painful neuropathy, vasculitis, proximal plus distal weakness, CIDP, sensory ataxia, B12 deficiency. Now, what are the most important neuropathies to know for exam? Guillain-Barré syndrome causes ascending paralysis and areflexia and can lead to respiratory failure, making it a medical emergency. CIDP is the chronic version with slower progression. Diabetic neuropathy is the most common distal symmetric pattern. Charcot-Marie-Tooth disease is hereditary with distal wasting, and vasculitic neuropathy is painful, asymmetric, and systemic. How do we diagnose neuropathy? Always start with clinical evaluation. The basic labs, glucose, B12, thyroid, and renal function. What is the role of nerve conduction studies? They help differentiate. Axonal would have low amplitude, and demyelinating would have slow velocity. CSF may show high proteins in Guillain-Barré syndrome and CIDP, and biopsy and genetics are used when needed. How do we manage neuropathy? First, treat the underlying cause. Control diabetes, remove toxins, replace vitamins. How do we treat immune neuropathies? It's with IVIG, IV immunoglobulins, steroids, or plasmapheresis. How do we treat pain that is associated with neuropathy? It is treated with drugs like gabapentin, duloxetine, and amitriptyline. And don't forget, rehabilitation, physiotherapy, and orthotics are important. When should we worry? Rapid progression, if there is respiratory weakness, if there is severe autonomic instability, asymmetry with systemic features, and weight loss. These require urgent action. Before we finish, what are the three key take home points? Number one, pattern recognition is a key. Number two, exon affects the strength, myelin affects the speed. Number three, focus on diabetic neuropathy and Guillain-Barré syndrome. Thank you for listening. If you find this helpful, and don't forget to like, subscribe, and I'll see you in the next video.